Physical therapy is a vital component in managing movement disorders and alleviating pain associated with a range of conditions, from neurological diseases to traumatic injuries. Physical therapists conduct thorough evaluations and design personalized treatment plans aimed at restoring physical function and enhancing mobility. According to the American Physical Therapy Association, these specialists are highly trained and licensed experts in human movement, capable of diagnosing and treating a broad spectrum of injuries and health conditions. A physical therapist plays a pivotal role in supporting patients throughout all phases of their healing journey, starting from the initial diagnosis through to recovery and preventive care. Physical therapy may be used as a primary treatment or in conjunction with other medical treatments, depending on the patient's condition. Patients are often referred to physical therapists by their doctors, but many also seek out therapy independently to address issues like chronic pain, injury recovery, or mobility challenges. Physical therapists are trained to perform thorough evaluations that include assessing movement, flexibility, muscle and joint function, and reviewing patients' health histories. This comprehensive approach allows them to provide precise clinical diagnoses and develop customized treatment plans with both short and long-term goals. They also offer self-management strategies, including exercises and lifestyle modifications that patients can implement at home to support their recovery. In addition to manual therapy techniques, physical therapy often incorporates various advanced modalities. Iontophoresis. This technique uses a low electrical current to deliver medication directly to the affected area, such as topical steroids, which helps reduce inflammation and pain. Electrical stimulation, e-stim. There are different types of e-stim, including transcutaneous electrical nerve stimulation, TENS, for pain relief, and neuromuscular electrical stimulation, NMES, to improve muscle activation and strength. Heat, moist heat, and cold therapy. These treatments can help alleviate pain, reduce swelling, and improve circulation in different conditions, aiding in overall recovery. Light therapy. This involves using specific wavelengths of light or lasers to treat conditions such as wound healing, pain management, and inflammation. Physical therapists work in a variety of settings, including outpatient clinics, hospitals, rehabilitation centers, nursing homes, and even patients' homes. They may also collaborate with other healthcare professionals to ensure a comprehensive approach to patient care. Their expertise is vital for managing complex conditions, improving physical function, and enhancing overall quality of life. Physical therapy offers a range of benefits tailored to individual needs, depending on the specific reasons for treatment. Some key advantages include pain management. It helps manage pain effectively, potentially reducing the reliance on opioids and other medications. Avoiding surgery. Many conditions can be managed or improved through physical therapy, sometimes avoiding the need for surgical intervention. Improved mobility and movement. Therapy enhances movement and flexibility, which can be crucial for daily activities. Recovery from injury or trauma. Physical therapy supports the healing process following injuries or trauma, aiding in a faster and more complete recovery. Recovery from stroke or paralysis. It assists in regaining function and improving quality of life after a stroke or paralysis. Fall prevention. Therapy helps improve balance and coordination, which can reduce the risk of falls. Management of age-related medical problems. It addresses issues common in older adults, such as arthritis and balance disorders. For athletes, sports therapists focus on optimizing performance by strengthening specific body parts and enhancing muscle use in new ways. Physical therapists or other healthcare professionals can provide guidance on how therapy can benefit individuals based on their personal medical history and treatment needs. Physical therapists offer valuable support for a wide range of medical conditions, tailoring their approach to enhance recovery and educate patients on optimizing their movement patterns. While they may not independently treat conditions outside the realm of musculoskeletal issues, their interventions are crucial in complementing other medical treatments and improving overall function. Physical therapy can be beneficial for various conditions, including cardiopulmonary conditions. These encompass chronic diseases such as chronic obstructive pulmonary disease, COPD, cystic fibrosis, and heart failure following a myocardial infarction. Physical therapists can help improve breathing, endurance, and overall cardiovascular health. Hand conditions. Issues like carpal tunnel syndrome and trigger finger can benefit from physical therapy techniques aimed at reducing pain and improving hand function. Musculoskeletal dysfunction. Common problems such as back pain, rotator cuff tears, and temporomandibular joint (TMJ) disorders are treated to alleviate pain, enhance mobility, and strengthen affected areas. Neurological conditions. Physical therapists work with patients recovering from stroke, spinal cord injuries, Parkinson's disease, multiple sclerosis, vestibular disorders, and traumatic brain injuries. Therapy focuses on improving motor function, balance, and coordination. Sports-related injuries. From concussions to tennis elbow, physical therapists help athletes recover and regain their strength and flexibility, often with specialized rehabilitation programs. Skin conditions and injuries. Physical therapy can aid in the management of burns, wound care, and diabetic ulcers, focusing on healing, reducing scar tissue, and improving skin function. Pediatric conditions. Pediatric physical therapy is designed to assess, treat, and manage conditions affecting infants, children, and adolescents. This specialized therapy addresses a range of issues, including developmental delays, cerebral palsy, spina bifida, and torticollis, as well as other conditions impacting the musculoskeletal system. Pediatric physical therapists focus on enhancing mobility, reducing pain, restoring function, and preventing or minimizing permanent physical disabilities. They work closely with children, their families, and caregivers to support and improve a child's ability to function independently and actively, both at home and in school settings. This collaborative approach ensures that therapy is tailored to each child's unique needs, promoting optimal growth and development. By addressing these diverse conditions, physical therapists play a key role in helping patients achieve better health outcomes and improved functional abilities. Physical therapy encompasses a variety of specialized approaches, each targeting different needs and conditions. These specialties include orthopedic physical therapy, focused on treating injuries related to the muscles, bones, ligaments, fascia, and tendons. This type addresses issues such as fractures, sprains, tendinitis, bursitis, chronic health conditions, and recovery from orthopedic surgeries. Treatment methods may involve joint mobilizations, manual therapy, strength and mobility training, among other techniques. Geriatric physical therapy, designed to assist older adults dealing with conditions that impact their mobility and overall physical function. This approach helps with ailments like arthritis, osteoporosis, Alzheimer's disease, hip and joint replacements, balance issues, and incontinence. The goal is to improve mobility, alleviate pain, and enhance physical fitness. Neurological physical therapy. This type addresses neurological disorders including Alzheimer's disease, brain injuries, cerebral palsy, multiple sclerosis, Parkinson's disease, spinal cord injuries, and strokes. Therapy aims to boost limb responsiveness, refine movement patterns, manage muscle tone, and improve strength and balance. Wound care therapy. Essential for managing the healing process of wounds, this therapy ensures proper oxygenation and blood flow to the affected area through improved circulation. It may involve manual therapies, electrical stimulation, compression therapy, and specialized wound care techniques. Vestibular therapy. Targeting balance issues linked to inner ear conditions, vestibular therapy employs various exercises and manual techniques to help patients regain balance and coordination. Decongestive therapy. This approach assists in draining excess fluid from patients with lymphedema and other fluid retention conditions. Pelvic floor rehabilitation. Addressing pelvic floor disorders. This therapy helps treat issues like urinary or fecal incontinence, urinary urgency, and pelvic pain resulting from injuries, surgeries, or specific medical conditions. Overall, physical therapists play a vital role in addressing a range of conditions, enhancing recovery, and educating patients on optimizing their movement patterns. They work collaboratively with other healthcare professionals to complement medical treatments and improve functional outcomes, addressing conditions like cardiopulmonary diseases, hand issues, musculoskeletal and neurological disorders, pediatric conditions, sports injuries, pelvic floor dysfunction, and skin conditions. Through their comprehensive approach, physical therapists contribute significantly to better health outcomes and improved quality of life for their patients. In summary, physical therapy is a versatile and vital component of healthcare that supports individuals in managing pain, enhancing movement, and recovering from various conditions. Whether addressing chronic pain, aiding in injury recovery, or optimizing functional performance, physical therapists offer personalized care tailored to each patient's unique needs. Their expertise in evaluating and treating a wide range of medical issues helps improve quality of life and prevent further complications. By integrating physical therapy with other treatments and providing education on self-management, physical therapists play a crucial role in helping patients achieve their health goals and maintain their well-being. Please click on the next video for more Live Good info. Thank you very much.